Are you seeing double? Because for about 3% of you, you are going to have 2 babies at one time. Let's talk twins. All right, I gotta know. Are you pregnant right now with twins, or have you already had a set of twins, or 2, or 3, or do you just find twins really, really cool? Whatever it is, let me know right now in the comments what type of twins you're expecting, or what flavor of twins are already in your life. Because for the majority of you, the twins you know and love, they are going to be fraternal twins, because they're around 70% of twin pregnancies. These ones are also known as dizygotic twins. Now, di means 2, and that makes sense because for this to happen, you need 2 eggs and 2 sperm to meet up, and then they make 2 separate babies. This is pretty well the equivalent of being pregnant twice at the same time. And that is very different than identical twins. This is going to happen in around 30% of twin pregnancies, and these ones, they are also known as monozygotic twins. Mono means 1, which also makes sense because for this to happen, you need 1 sperm and 1 egg to meet up and do their thing, and they become fertilized. Now, this single fertilized cell will at some point in time split and become 2 different embryos with the same genetic makeup. Now, depending on when in the pregnancy they split, that's going to depend on what type of setup they have in utero, and we are going to go over all of that in a little bit. So my name is Tina B. I am a labor and delivery nurse with my specialization in perinatal nursing. If this type of content interests you, go ahead and boop that subscribe button, and let's move on right now to fraternal twins. If you remember that fraternal twins is like having 2 different pregnancies at the same time, then it would make sense that their genetic makeup is no more similar than any 2 brothers or any 2 sisters born to the same parents. But then how do fraternal twins happen? Most times it happens from something called hyperovulation, where you release more than 1 egg at the same time, and then it makes sense that you could actually fertilize both those eggs in 1 session of intercourse. But this can also happen if you release 2 eggs close together, not at the same time, but close together. And then if you have intercourse that is timed the same way, you can actually end up with fraternal twins that have 2 different due dates. Now, this could also happen if you have different partners, and then you happen to have intercourse when you release 2 different eggs, and then you can end up with fraternal twins that actually have 2 different dads. You now know that fraternal twins and identical twins, they are very, very different. But I mentioned in the beginning of the video that when the split happens in an identical twin pregnancy, that determines what setup each baby has in utero. But what does a setup for a baby mean? It means how many placentas and how many amniotic sacs they have, because this is actually going to be different depending on the type of identical twin pregnancy you have. So let's go over all of it, starting at the beginning. If the split happens in the first 3 days of your pregnancy, this is going to result in each baby having their own setup, meaning each baby has a placenta and each baby has an amniotic sac. Now, this is true for 100% of fraternal twins, but it is also true for 25% of identical twin pregnancies. And if we do some math, now inside your belly, there are 2 amniotic sacs and there are 2 placentas. When we talk about 2, we can also use the word di, which we used earlier when we were talking about twins. When we're talking about placentas, we're going to say the word chorionic. When we're talking about amniotic sacs, we're going to say the word amniotic. So a baby with its own setup and 2 of them in your belly, that means you have a dichorionic, diamniotic. This is a di twin pregnancy. If you press fast forward and the split happens between days 4 through 8, each baby will still have their own amniotic sac. They are still floating solo and they still have their own protective bubble, but now they're going to share a placenta. So we know that mono and 1, those words are interchangeable. So we now have 1 placenta, monochorionic, 2 amniotic sacs, diamniotic. This twin pregnancy is now known as monochorionic diamniotic, or MO-DI twins. So because these twins share a placenta, they are actually at risk of something called twin-to-twin transfusion syndrome. And when this happens, the blood in the placenta itself, it is not equally distributed to both twins, and that results in 1 twin that is much smaller and 1 twin that is much larger. Now, the smaller twin, it is giving away much more blood than it is able to take, and the larger twin, it is taking lots of blood and it is not able to get rid of that blood. And as you can imagine, this is going to have health implications for both twins. So the twin that is giving away more blood than it is receiving, that is going to be the smaller twin, also referred to as the donor twin. Now, when there's not enough blood coming in, the kidneys can't appropriately filter, which is going to affect baby's bladder development. And when the bladder is affected, that means that amniotic fluid levels, they are going to be lower than they should be, because pee is a major player in amniotic fluid. And with those low levels of amniotic fluid, baby's other major system developments are affected as well. Their respiratory system, or how they are practicing their breathing movements, that's affected. Their digestive system is affected. And then, of course, their bladder and their kidneys, they continue to be affected. It's like a big cycle. And then if that is not enough for that little twin, their heart is also affected. They don't have enough blood to pump appropriately. And when babies' hearts can't pump appropriately, that is very, very detrimental for their health. Now, if we switch gears to the twin that is taking on all that extra blood and is unable to get rid of it, this is now going to be the bigger twin of the two, also known as the recipient twin. And this twin, they have a list of problems very, very similar, but in reverse. So now they have too much blood volume for their heart to handle for their little body, and it could often lead to heart failure. And then their bladder, it is actually filling and emptying too quickly, which is going to lead to too much amniotic fluid, otherwise known as polyhydramnios. So bigger is not always better. Now, twin-to-twin transfusion syndrome, it is going to affect around 10 to 15% of monochorionic twin pregnancies. Moving forward, if the split happens between days 8 and 13, these babies are very, very good at sharing because they share everything. They now have one placenta, monochorionic, one amniotic sac, monoamniotic. These twins are mo twins. You might also hear them referred to as mono twins. Now, this type of twin pregnancy is very risky because they do share the placenta, so they have all of those risks of twin-to-twin transfusion syndrome, but they also share an amniotic sac, meaning that them and their umbilical cords, they are floating around all in one space together. So they do have a risk of their cords getting tangled amongst each other. And that in itself means that those cords can have knots in them that can cause compression of the cord. Now, this can actually cause miscarriage. It can cause stillbirth. It can cause cerebral palsy if the cords are compressed and the oxygen flow to baby is decreased. So this pregnancy will be monitored very, very closely. Unfortunately, the survival rate of this type of pregnancy in twins is only 70%. Now, if the split happens much later in pregnancy, after day 13, this is likely going to result in something called conjoined twins. And in conjoined twins, this means that the two babies, they are actually fused together at a certain body part. Now, some body parts are more common than others. Most common are the thorax, or sort of in this region here, or the abdomen, and the least common body part would be at the head. This is much more common in female-female twins with a ratio of about 3 to 1 female to male. These twins, they always have one placenta and they always have one amniotic sac. So conjoined twins, they are always mo twins. Now, some conjoined twins can actually be separated after birth, but some sadly cannot. And so the survival rate for conjoined twins is only 7.5%. So now you know the different types of twins, but what can you expect when you show up to give birth to your twins? First thing I'm going to tell you for sure, there's going to be all eyes on you because your twin birth experience, it is really cool and really exciting for you, but it is also really cool and really exciting for your healthcare team because twin births, they do not come around nearly as often as single births. And so I can guarantee you this, there will be learners that want to be a part of your case. So if learners are not a part of your birthing experience or your birth plan, you really need to speak up early to your healthcare team and to your provider because they're going to want to be in there. The next thing people always ask is, because I'm having twins, do I have to have a C-section? I'm going to tell you right now, most times twins are born by C-section, but that doesn't mean that they have to be. If twin A, or the twin that is closest to your cervix, if they are head down, there is a good chance that you could have your twins vaginally. This, of course, is going to depend on your provider and your specific situation. So is your twin A head down? Have you had a baby before? How many placentas are there? How many amniotic sacs are there? Lots of different pieces can go into this puzzle. So there is a chance definitely that you could give birth vaginally, but be aware of this, regardless of whether you have a C-section or you have a vaginal twin birth, that experience will be happening in an OR setting. And that is because if you're having a vaginal birth and twin A comes out and then there is trouble with twin B, they need to be able to get that twin B out right away, which would mean changing over to an emergency C-section. So you will be in the operating room. One last thing I can guarantee you is that that room, it is going to be crowded because twin birthday parties, they are really epic. Each one of your babies, they're going to have their own team at their own warmer to help them transition to life outside of utero if they need it. Your provider will also for sure have a partner with them because they have a lot of things to do in a short period of time to keep everybody safe. And you'll have a primary nurse, and then that nurse will have at least 1 or 2 other people with them because, again, a ton of things to do for a twin delivery. Now, things like delayed cord clamping and skin to skin and your partner cutting the cord, those are all going to depend on quite a few factors, like how far along were you when the babies were born? What type of twins do you have in there? How are they when they come out of you and they are starting to do their transition? So definitely chat with your provider about what to expect for your specific twin delivery. So double the pleasure and double the fun. I hope you love this one. Go ahead and give it a thumbs up. Consider subscribing. If you've loved what you've been learning, check out this other video. I'm sure you would love that one too, and I'll see you next time. Bye.